So the creme de la creme, here she comes. We are going to hear a little bit here about, this is Dr. Tonia Young-Fadok, full professor of surgery. She has spent a great deal of time in helping our patients with colorectal problems, so please help me welcome her.
Good morning, everyone. First off, two things. One, I don't think I have time to include all the things that Anita said I was going to include. And secondly, I put up here the term fecal incontinence. This is not the term I use with my patients. I see patients who have something coming out of their tush that they don't want coming out at times that they don't want coming out. That can be stool, whether it's solid or liquid. It can be gas, it can be hemorrhoids, it can be mucus, it can be their entire rectum. But anything that's coming out, they see me, and then I clarify what's coming out. I use the term fecal incontinence here primarily because that's what's used in the surgical literature. So I have no disclosures. I wish I did. And for those of you who are not from Arizona, welcome. So the learning objectives, we want to look at options for fecal incontinence if conservative measures fail, and be aware of the pros and cons of surgical options. What I want to do today is try to demystify some of the black box of surgical options. We're going to look a little bit more closely at sacral nerve stimulation and its role, identify patients who may benefit from that and from some of the other surgical options. And I want to talk to you about the field change that's happening in colorectal surgery in terms of where we see sacral nerve stimulation fitting into things. So as we saw, the prevalence, depending on which study you look at, which population you look at, what age group you look at, is markedly different, but much higher than is currently reported. Primarily because patients feel it's shameful, and we just heard from several different sources here about that. Surgery is reserved for patients who fail conservative measures. The patient doesn't have an accident and immediately get an operation. And we'll talk a little bit more about some of those conservative measures. Fecal incontinence is also of a couple of different types, urge or passive. And the causes can be multifactorial, as you just heard. Sphincter weakness, which can be from, again, many sources. Age, the muscle atrophies. Pudendal nerve weakness, which often manifests itself many years after delivery. Or true anatomic defects of the sphincter where there's been a tear, typically with obstetric injury, also rape, abuse. Again, it's not clear